Are you wondering if breastfeeding can cause breast cancer? In this video, I will uncover the truth and present you with scientific evidence on the relationship between breastfeeding and breast cancer. 1. Can breastfeeding increase the risk of breast cancer? The short answer is no. Studies have not found any connection between breastfeeding and an increase in the risk of breast cancer. In fact, research has suggested that breastfeeding may potentially reduce the risk of certain subtypes of breast cancer. 2. Does breastfeeding reduce the risk of developing breast cancer? Studies have shown that breastfeeding can reduce the risk of developing breast cancer. Women who breastfeed their babies for at least 6 months have a lower risk of developing the disease than those who do not. Researchers believe that this is due to the fact that lactation suppresses ovulation and reduces estrogen levels, which are both linked to breast cancer. Additionally, breastfeeding may help improve immunity and reduce inflammation, which could also protect against certain types of cancers. In summary, there is evidence suggesting that breastfeeding can reduce the risk of developing breast cancer. However, it is essential to note that further research is needed to better understand this relationship. Additionally, other factors such as genetics and lifestyle choices should also be taken into consideration when assessing risk. Ultimately, it is important to speak with your healthcare provider to understand the best course of action for you and your family. 3. What are the possible benefits associated with breastfeeding and breast cancer prevention? Studies have suggested that breastfeeding may reduce the risk of breast cancer by suppressing ovulation, reducing the amount of time a woman spends in her reproductive years, and lowering levels of hormones like estrogen. Breastfeeding also appears to help repair tissue damage from previous pregnancies and hormonal changes, as well as provide immune protection for infants. It is thought that these benefits may help protect against breast cancer later in life. Additionally, nursing mothers often have lower levels of body fat, which can reduce estrogen production, again potentially providing some benefit to reducing the risk of developing breast cancer. Ultimately, it is important to be aware that there are many factors at play when it comes to determining one's risk for developing breast cancer, including diet, lifestyle habits, family history, and overall health. It is important to speak with your physician or healthcare provider if you have any questions or concerns regarding your risk for breast cancer. Additionally, it is important to remember that breastfeeding should never be used as a form of birth control. For more information about the benefits of breastfeeding, please talk with your obstetrician or lactation consultant. 4. Is there any scientific evidence that shows a link between breastfeeding and breast cancer? Yes, according to research, there is a link between breastfeeding and breast cancer. Studies have found that women who breastfeed for at least 1 year are more likely to develop breast cancer than those who do not. While the evidence of a link is strong, it is important to note that other factors may also play a role in the development of this disease. Factors like family history, alcohol consumption, obesity, and smoking all increase the risk of developing breast cancer. 5. Are there any studies or research that suggest mothers who do not breastfeed have a high risk of developing breast cancer? The short answer is no. There are no studies that indicate any link between not breastfeeding and an increased risk of breast cancer. Studies have found, however, that breastfeeding appears to reduce the risk of developing premenopausal breast cancer. This is likely because the action of lactation suppresses the body's production of female hormones that can stimulate tumor growth. At this time, there is no evidence to suggest that mothers who do not breastfeed have an increased risk of developing breast cancer compared to those who do. That said, other research has suggested some correlations between a lack of breastfeeding and certain lifestyle-related factors known to increase the risk for certain types of cancers, such as obesity. 6. How long should a woman ideally continue to breastfeed in order to receive maximum protective benefits against developing breast cancer later in life? The exact amount of time a woman should breastfeed to receive maximum protective benefits against developing breast cancer later in life is not completely known. However, research has shown that the longer a woman continues to breastfeed, the more protection she can get from developing this type of cancer. The World Health Organization recommends exclusive breastfeeding for at least 6 months and then supplemented with other foods up until 2 years or beyond. However, even women who only partially breastfeed may still benefit from some protection. Women who have done sustained breastfeeding a combined total of 12 months or more have been found to have lower rates of both pre- and postmenopausal breast cancers compared to those who never nursed their children. 7. Are there potential risks associated with prolonged breastfeeding on women's health, such as an increased risk of developing certain types of cancers later in life? Unfortunately, the answer to this question is not straightforward. There is some evidence that suggests that breastfeeding for more than 1 year may be associated with an increased risk of certain types of breast cancer in women. However, there are other studies that show no such correlation between prolonged breastfeeding and breast cancer risk. Ultimately, the best advice for women considering extended periods of breastfeeding should always be to discuss their decision with their healthcare provider, who can provide personalized advice based on a woman's individual medical history and risk factors. Additionally, it is important to note that the potential risks associated with extended breastfeeding must be weighed against its many potential benefits for both mother and baby. We hope this video has helped shed some light on the potential relationship between breastfeeding and breast cancer. While more research is needed to understand if there is a direct link, it's important for mothers to be aware of all possible risks before making any decisions about their health or that of their baby. We encourage you to talk with your doctor if you have any concerns or questions regarding the topic discussed in this video. If you found our content helpful, please leave us a comment down below, and don't forget to subscribe. Thank you for watching.